Okay. So. Had genetics testing done. Okay. My understanding of it is if you have markers, doesn't per se mean you have the disease, but the risk is there, the risk is greater, so on and so forth. Okay. Whether you want to know or not, this is my medical journey. Okay, this is my health journey. Okay, because these are just a few of the things that have popped up. And I have symptoms. Okay, so we're gonna start with like my red risk, my main risks, and then possible risks, which are orange. They're all bad. They're all genetics. Okay. And like I said, I have symptoms. I've had symptoms for years. Do I have proof? Unfortunately, no. Different apps made you pay to get access to them, whatever. Okay, so let's just start here. Okay, type 2 diabetes. Okay, lip, oral cavity carcinoma, which is mouth cancer. Okay, schizophrenia. Yeah, okay. Multiple sclerosis, or MS5. Hirschsprung disease, which it affects the large intestine and the colon. I did have a colonoscopy. I was told I look clear. I shouldn't have to have one for another 10 years. Okay. Still, how far do they go on the colonoscopy? Okay, I don't know. I was told I look good though. OCD. I can see it. Okay, migraine with or without aura. Okay, these are migraines. I do get migraines that are so freaking bad, nothing helps. Nothing. And they can last 24 hours. Okay. I have multiple genetic variants for Alzheimer's. I have Alzheimer's, autism, congenital heart disease, abnormal pulmonary intestinal rheumatoid arthritis. Okay, and I feel it. I feel it every day, but my numbers are fine. I'm good. Bullshit. Let's see. Age-related macular degeneration. 5, 6, and 7. It's my eyes. Ascending aortic dissection, or type A aortic dissection, which has to do with your heart. And that has 11. I have 11 markers for that one. Aspirin-induced asthma. Artillery fibrillation 3 and 7. I actually think there's like 3 or 4 different ones for that one. ADHD, autism spectrum disorder, 1, 10, and 15, autosomal dominant Parkinson's, number 8, 8's on there, calcium oxalate nephrolitasis, basically kidney stones, which I know I do. Both of my kidneys are full of stones. I've known that for years. Cataplexy and necrolepsy, which has something to do with sleeping, which I believe it, yes. I'm flipping a page, and this is just some of them. Carcinoma, which is bile duct cancer, or cancer of the liver. Chronic obstruction pulmonary disease, COPD, lungs. I have one. Actually, I'm going to save it for last. Conrod dysphoria, dominant 5 and 11, which has to do with my eyes. Coronary artery spasm, 1, 3, 4, and then some. Which, heart, obviously. Cystic fibrosis. Dystonia 16, or also known as DYT 16. They're muscle contractions while at rest, which I do have. I twitch. I do have markers for Ehlers-Danlos syndrome, estrogen resistance syndrome, familiar cancer of breast, familiar colorectal cancer, and familiar otitis media, which is the eyes. Hepatocellular carcinoma, which is liver cancer. Keratoconus, which has to do with the eyes. Get this. I have multiple markers for Hansen's disease. And if you do not know what Hansen's disease is, it is also known as leprosy, which I have markers for early onset, 1 and 5. You'd have to look up what all the difference is. I just wrote down what all I have issues with, or what markers I have. Rhinitis pigmentosa, which has something to do with the eyes. I have multiple markers for them, including recessive and dominant genes. Squamous cell lung carcinoma, which again, lung cancer. And I also have multiple markers for TSC, tuberous sclerosis syndrome, which I have multiple markers of that. Okay, and the last one before I run out of time. I have 184 markers. Okay, 184 markers. Condition name not yet identified by the scientific community. Excuse me? Why can't I get my disability? Really like some help. Be nice. I mean,